Transurethral resection of the prostate, or TURP, a patient information video. The prostate gland is only present in men and is situated at the base of the bladder. The tube from the bladder to the tip of the penis, the urethra, passes through the middle of the prostate gland. The gland secretes fluid in which sperm are expelled during intercourse. After the age of 50, the prostate gland enlarges, squeezing the urethra and slowing the flow of urine from the bladder. Why is transurethral resection of the prostate necessary? The prostate gland grows slowly through life. In some men, it enlarges to cause a number of problems. These include difficulty in passing urine, poor stream, frequent urination, incontinence. A small number of men develop complete blockage and suddenly find they cannot pass urine at all. This is called acute urine retention and requires urgent medical attention. Your surgeon has recommended you consider a transurethral resection of the prostate operation. TURP is designed to improve symptoms by reducing the size of your prostate. It is also a diagnostic procedure. Tissue removed is routinely sent to the laboratory to assess for the presence of cancer cells. On the day of your operation, you will arrive at your hospital's admission lounge. Here, you will undergo some routine checks. You will be seen by a member of the surgical team who will go through the consent form with you. This is a good time to ask questions. You will be asked to change into a surgical gown, put on some thromboembolism prevention stockings. You may receive an intravenous line, and then you'll be taken to the anaesthetic room. You will receive your anaesthetic prior to being transferred through to the theatre. Once in theatre, your legs will be raised and placed into surgical stirrups. Your penis will be cleaned with an antiseptic. The surgeon will then introduce a lubricated instrument into your penis. This instrument is attached to a camera and the images are displayed on a monitor in front of the surgeon. The surgeon will straighten your penis. As the instrument approaches the base of the penis will be pulled down, allowing entry through the prostate and then into the bladder. It is routine at this point to complete an examination of the bladder. Once a thorough examination has been completed, your surgeon can pass a loop through the instrument and begin to shave away the prostate. The surgeon will then start shaving away the prostate, firstly from the middle and then working further out. The shavings will be washed away with the fluid. They'll be collected and sent to the laboratory for assessment later that day. Results can take up to 2 weeks. Once the operation is completed, a urinary catheter or tube will be placed into the bladder. At the end of this tube is a balloon, and this will be inflated. The balloon at the end of the catheter will be inflated. This will stop it from falling out and allow urine to drain freely. After the operation, you can expect to have a plastic tube from your penis, an oxygen mask over your mouth, and a drip in one of your arms. You can eat and drink as soon as you are alert enough after a general anaesthetic or when you get back to the ward after a spinal anaesthetic. Severe pain following this procedure is unusual. If you're in pain, inform the nursing staff and they will give you some medication. You may experience some discomfort from the catheter, and this is normal. Some men feel as though they want to pass urine constantly due to the catheter pressing on the sensitive part of the bladder. It is important that you have a bowel movement before the catheter is removed, usually 1 or 2 days after the operation. Do not expect to have perfectly normal control of your urine immediately. The internal wound will take several weeks to heal and settle. During the spell, there is inflammation at the base of the bladder, perhaps causing you to urinate more frequently, sometimes with burning, loss of control, and urgency. However, many patients have no problems following surgery. It is important that you drink 2 to 3 litres of fluid each day to wash out the bladder. Typically, you can go home 2 to 4 days after the surgery but this does vary from patient to patient. At home, you will continue to improve gradually. It is not unusual for a little blood to reappear in the urine after it has been clear. If the bleeding is very heavy, you have difficulty passing urine, or you have severe pain or burning when passing urine, please return to A&E. Many patients experience symptoms for over 6 weeks because the healing process takes time. Full recovery from the operation can take 12 weeks. Returning to work. This varies from patient to patient, but normally you'd expect to be fit for work 3 to 4 weeks after your operation. You should avoid strenuous activities and heavy lifting for several months. Resuming sexual function. Intercourse may be resumed after 4 to 6 weeks. Potency is not affected in the vast majority of patients. However, a very small minority do report impotence. The only difference you may notice is on ejaculation, when very little, if any, seminal fluid is produced, although sensation is normal. Resuming physical activity. You should be able to get back to your normal gentle physical activities within 3 weeks. You may start to drive the car after 2 weeks or when you feel fit enough. We advise you contact your insurance company regarding resuming driving. Activities should be resumed in short sessions after about 4 weeks and then gradually built up to normal. You are strongly advised not to undertake any heavy lifting for 4 to 6 weeks as further bleeding can occur. Follow-up. If recovery from the operation has been uncomplicated, it will not be necessary for you to have follow-up appointment at the hospital clinic. The laboratory tissue examination will not be available on discharge. Results requiring further investigation will be actioned by your consultant. Any operation has some risk. Although rare, you need to be aware of these particular risks and weigh them against the benefits and improvements. These include damage to the functioning of the muscle controlling the bladder, scarring of the urethra or water pipe, injury to nearby tissues and excessive bleeding, blood clots in the legs and lungs, infection, allergic reaction to drugs or anaesthetic, breathing difficulties, recurrence of the original problem, and impotence in about 1 in 100 cases. Thank you for watching this patient information video by Jeremy Nettleton.